My name is Alex Blinkhorn, and this is the case analysis of GlaxoSmithKline Pharmaceuticals. I made this PowerPoint, presentation, and paper with the help of Marcus Smith and Michaela Santiago. GlaxoSmithKline is based in London, England, but has a headquarters in the US in Philadelphia as well. They were formed in 2000 in a merger between Glaxo Wellcome and SmithKline Beecham. They're currently the 196th largest company in the world, and their CEO is Emma Walmsley, who was actually the first female CEO of any pharmaceutical firm in the world. The case background for GlaxoSmithKline. GlaxoSmithKline faced a large amount of ethical backlash in the past 2 decades. During 2012, they paid a $3 billion settlement for drug promotion, failure to disclose safety issues, and for bribing physicians with kickbacks if they sold more of the pharmaceuticals that GlaxoSmithKline was delivering them. The incentives for GlaxoSmithKline's sales associates motivated unethical behavior. Sales associates were incentivized to get sales however possible, which motivated them to do unethical things. The company realized that they needed to transition from a sales commission to a process-based and knowledge-based incentive program for their employees. This was a program that incentivized employees to, instead of meeting sales targets, to understand the drug, to meet with the physicians, and to do the things that GlaxoSmithKline believed will help to sell their product in a more ethical and fair way. It motivates their employees to follow procedure and behave properly. GlaxoSmithKline's central issue identification. GlaxoSmithKline has had some issues with adoption of its new program. They knew that when they transitioned from the sales incentive to this new program, that they would have some issues with adoption that they would need to resolve and work on. Some of the employees complain that they're making less money under the new program compared to when they did using the sales incentive. The regional business managers still have sales targets like they did in the old program, but they can't motivate their employees to achieve those sales targets because now their subordinates are currently motivated by the new system. Some of the employees struggle to achieve the new incentives, saying they're unclear and more complex than the old sales program. Overall, lower adoption rates among GlaxoSmithKline's employees mean less sales for the organization. The sales associates make up a huge percentage, if not all, of the company's profit, and so their success is critical to GlaxoSmithKline. GlaxoSmithKline's issue resolution. There are 3 possible solutions GlaxoSmithKline could implement to resolve their issues with adoption within the company. GlaxoSmithKline could intentionally cause large-scale turnover in the organization to help bringing in a new guard and culture within the company to help make the transition. They could remove the sales target entirely, especially from the regional business managers, because that is still part of the old program and is causing a disconnect. Or they could remove the incentive program entirely from the organization and simply pay employees a flat rate. Any of these solutions could help resolve GlaxoSmithKline's adoption issues and help to make the transition into a new future for the company. GlaxoSmithKline's issue resolution, large-scale turnover. GlaxoSmithKline knew that the new incentive program would cause some turnover within the company. Any large-scale change in a company or organization is going to cause some of the old employees to look for new employment. It doesn't matter what the change is or how it affects them, even if it's a positive change. Some employees are going to be too stuck with the old method and want to look for something new. GlaxoSmithKline calculated for this and were expecting some turnover. However, GlaxoSmithKline could intentionally terminate and lay off employees who refuse to adopt and support the new program. This would create a new culture within the company due to the large amount of new employees and help to create a new program and new start for the company post the transition. However, there are some risks associated with large scale turnover in an organization. There are bad public relations associated with large scale turnover, and the recruiting and training cost of the new employees would be very expensive. GlaxoSmithKline issue resolution: the removal of the sales target. A significant part of the problem at GlaxoSmithKline is still the sales target. The point of the new incentive program at GlaxoSmithKline was to remove the sales target from their associates. That way, their associates would not be motivated to do unethical practices to meet those stressful sales incentives. The problem is the regional business managers are still evaluated and still use the sales targets that just like they did in the old program. They are judged on their sales and their subordinate sales. The problem is that there is a disconnect between the regional business managers and the sales associates. If the regional business managers are evaluated on how well their subordinates reach those sale targets, and their subordinates are motivated by their adoption of the new program and the process based and knowledge based system, then there's a disconnect where the regional business managers can't motivate their employees to follow the new system if they're trying to motivate their employees to follow the old system. The solution is to simply remove the sales targets from the regional business managers entirely. Remove sales targets from the company altogether. That way, the regional business managers are evaluated on how well their subordinates are reaching their goals in the new system. If their subordinates are all reaching the incentives and meeting their performance goals, then the regional business manager is doing a good job. GlaxoSmithKline issue resolution: the removal of the incentive program entirely. Employees are currently incentivized financially based on how well they follow the process and their knowledge of the product. This was a part of the new program rather than evaluate them based on their sales targets and financially incentivize them to meet those sales targets. Under the new system, it's by definition harder to define and meet those new targets compared to the old sales goals. Sales goals are easy to understand for employees, whereas this new system requires them to be evaluated on how well they know the product, how well they interact with physicians. It's far harder to financially incentivize them to do their job under the new system. The solution is to remove the incentive target entirely. No longer give employees any kind of financial incentive to perform well. That sounds negative, but that is how most organizations that don't do sales function. Employees get paid a flat rate and then usually get raises at some time based off their overall performance. That is what GlaxoSmithKline could do under their new program. Simply pay the employees a flat rate that consists of their current base pay plus a significant percentage of the commissions that they would be receiving in the past. Then give performance ratings on a biannual amount of time that gives raises depending on how well they did during their performance and their job. This rewards their performance still, but removes that daily stress to perform well and will still meet their goal of preventing unethical behavior in their employees. The biggest risk of doing this would be upsetting the employees who are currently reaching their max performance goals and their max commission goals. Those employees would likely be making less money, even though they are the best sales associates at the company, and losing those employees would be a risk to GlaxoSmithKline. GlaxoSmithKline's best resolution method. GlaxoSmithKline's largest problem is the regional business managers and their sales targets. The sales targets that the regional business managers are motivated by are a part of the old system. The adoption issues stem from that because The intention of the new program was to move away from sales targets, yet the regional business managers are still incentivized by those same sales targets that they were in the past. The sales targets undermine the whole meaning and point of the system. The regional business managers currently have to motivate their subordinates to do something that those subordinates don't want to do and aren't financially incentivized to do. So, removing that sales target and replacing it with overall performance scores for their employees fixes the issue and does a significant job in helping to contribute to the new adoption of the new program. In conclusion, GlaxoSmithKline has a long legacy and history starting in the early 1920s. In the past 2 decades, the company realized that they needed to change significantly to avoid the ethical issues that they had faced in the past. So the company decided that they needed to transition from a sales incentive that motivated unethical behavior to a new knowledge and process based incentive program that benefits the employees, it benefits physicians, and it benefits the people receiving GlaxoSmithKline's pharmaceuticals. The company has had some adoption issues, but those can be resolved by removing the sales target in accompaniment with other methods listed earlier. This should lead GlaxoSmithKline to overall better performance than ever before without the ethical risks that they faced in the 2010s and 2000s and the same ethical risks faced by other pharmaceutical firms.